Smith and Margaret meets at a park for discussion before marriage.
I believe you now know all my family members, especially now that we are about to get married.
Of course, Smith. You have introduced me to all your family relatives as well as many of your kinsmen. Are you forgetting that you took me on a visitation tour last summer?
But you are yet to take me to your family.
You know I will love to whenever you so desire. You have already read me like a book. You know me down to my blood type and sickle cell status. And you know I can't hide anything from you.
I know that, my dear, and I trust you. Then, we will have to go visit your family so as to seek their consent before picking a date for the necessary marriage rites to seal our union.
Anytime you wish we go, I am available.
Let's make it this weekend. On Saturday, at 7 p.m.
Okay, dear.
Smith and Margaret got married 3 months later. A year after their wedding, they had their first daughter and things were going smoothly with their marriage.
Honey, thanks for being with me from my little beginning. See how far we have come together.
My soul, you are my all. I am nothing without you.
Hope Diana ate before sleeping.
Yes, dear. You should have known your daughter by now. There is no way she will be this quiet if she haven't eaten.
Else I forget there is a good news.
Honey, what is the good news?
I got a mail from the oil company I applied for the position of an experienced risk management officer saying that I should come to the capital for documentation and immediately start up.
Wow, this is a great news. I am so happy for you. This is worth celebrating.
Indeed, me love, indeed. This might require that we relocate depending on where I will be posted to.
That is not a problem, honey, that offer worth it. Please dear, let me check what is on the fire, I will be back.
Okay dear.
3 years later.
God, what kind of problem is this? In the past 3 years I have had 5 miscarriages. Who did we offend? God, why is this happening? After our first daughter, we haven't had another. I have to inform my husband about this immediately.
Honey, what is wrong? Why are you crying?
Honey, I just had another miscarriage.
Another miscarriage. Dear, you need to see a doctor tomorrow for us to understand what exactly is wrong. This doesn't seem common anymore. Honey, I know you are going through a lot now. It will all be fine with time. Visit the doctor tomorrow and complain about what we have gone through in the past 3 years. I would have loved to go with you but have to be at the new oil field for inspection.
Okay honey, I will visit the doctor to find out what the problem could be.
At the hospital the next day.
Doctor, I don't know what is wrong with me. I have had 5 miscarriages in the last 3 years after having my first daughter. Please doctor, I need help.
Mrs. Margaret, sorry for the experience you have had in the last 3 years and the pain you are going through right now. I will have to examine you to confirm the miscarriage and check for the possible cause of it. Firstly, what is your blood type and that of your husband?
We are both of the A type.
What about your rhesus status?
Doctor, I don't know what you're talking about.
Rhesus factor is an inherited protein found on the surface of red blood corpuscles. If your blood has the protein, you are rhesus positive, but if your blood does not, you are negative. That is why blood types are designated as either plus or minus for the different types. You can either be a plus or a minus. Bring me your blood sample and that of your husband tomorrow for check to confirm your rhesus status and that of your husband.
Doctor, I will do just as you have said.
If you bring the samples tomorrow, you will have to check back after 2 days for the result.
Okay doctor, I will be leaving now.
I will be expecting the samples then.
3 days later, Mrs. Margaret went back to the hospital for the result of the test.
Doctor, please, what did you find out from the test?
Mrs. Margaret, the result of the test shows that you are rhesus negative while your husband is positive.
Doctor, how does this concern my miscarriages?
Studies have proven that 94% of the global population are positive while 6% are negative. Having a rhesus negative blood type isn't an illness and doesn't affect your health. But it can affect your pregnancy. Your pregnancy will need a special care if you are rhesus negative and your baby is positive. This is called rhesus incompatibility. A baby can inherit the rhesus factor from either parent. In your case, from your husband.
So, how have this been affecting my pregnancies?
If you are rhesus negative and your baby is positive, your blood might produce proteins called rhesus antibodies if your blood mix with that of your baby. Normally, blood of a pregnant woman doesn't mix with that of the baby in her womb, except during delivery or due to complications. The first baby to trigger this may not be affected, especially if the blood of the mother and baby mixed during birth. But other babies the woman will conceive might be affected.
How, doctor?
If the next baby is rhesus positive, the rhesus antibodies can cross the placenta and damage the baby's red blood cells, resulting in a life-threatening anemia, which I suspect could be the possible cause of your miscarriages.
Oh my God.
This is why if you are rhesus negative as an expecting mother, you need to have blood test called antibody screening, several times during your first trimester, as well as at week 28 and after delivery. This test is used to monitor production of antibodies produced in response to rhesus-positive blood. If you have not started to produce rhesus antibodies, you will be given a shot of rhesus immune globulin to prevent your body from producing rhesus antibodies during your pregnancy. This is part of prenatal care. After birth, if your baby is rhesus negative, you don't need any other treatment, but if your baby is born Rh positive, you will need another injection shortly after delivery. As we speak, you need to be injected adequate dose of rhesus immune globulin to neutralize rhesus antibodies in your system that led to the last miscarriage.
Doctor, please help me however you can. I need to have more babies.
You will, Mrs. Margaret. I will inject you before you leave, but you will have to come for checkup often, for this to be achieved. Also note that this treatment will be required in event of an ectopic pregnancy, abortion, amniocentesis, chorionic villus sampling, chordocentesis, bleeding during pregnancy, injury or trauma to the abdomen during pregnancy, external manual rotation of a baby in a breech or buttocks first position, and after delivery, if the baby is born rhesus positive.
Doctor, I am relieved now. At least I have hope of having more children. Thanks for the information. I can now advise others with same condition to help them avoid miscarriages like mine and the depression associated with it.
You are always welcome, Mrs. Margaret.
5 years later, Mrs. Margaret and her husband begot 3 more children, and her 5th miscarriage was her last.
Thanks for watching. Please like, comment and share to help people out there. Don't forget to subscribe to my channel if you haven't, and turn on the notification bell to be one of the first to be notified each time a video is dropped.